Welcome to the Senior Techie Podcast. Um, Imagine for a second just staring at a garage that is absolutely filled with, 40 years of memories.
Yeah, that's a heavy feeling.
It really is.
Yeah.
And knowing that you somehow have to fit the story of your entire adult life into, I don't know, maybe 50 cardboard boxes.
Yeah.
Or, maybe it's not the garage.
Right. Sometimes it's right inside the house.
Exactly. Maybe it's realizing that the 3 bedrooms upstairs haven't been vacuumed in 6 months because, well, the stairs are just getting way too daunting to climb.
Which is incredibly common, honestly.
It is. And today we are looking at a central theme that surfaces constantly in the sources we've been reviewing. It's that massive, almost paralyzing gap between knowing your current housing situation is becoming, a bit of a hazard and actually doing something about it.
Right. Taking that first step is the hardest part.
Exactly. And if you are listening right now, I want to establish something right up front. You are entirely capable of navigating this. We talk a lot on the Senior Techie about mastering new technologies and systems.
And this is just another system, really.
That's exactly it. Housing transitions are ultimately just a complex system, and like any system, you can learn to manage it.
And I think it's so important to validate what you might be feeling right now. That overwhelm is incredibly common, and it usually gets mislabeled by well-meaning family members as denial.
Oh, right. Mom's just in denial about her mobility.
Exactly. But when we look at the research, it isn't denial at all. You know your own body. You see the stairs getting steeper. The hesitation actually comes from the fact that no one hands you a structural roadmap for dismantling a life's infrastructure.
Yeah, nobody teaches a class on this.
They really don't. The process of sorting decades of belongings combined with the prospect of navigating, tense family dynamics, it creates a genuine logistical and emotional gridlock.
It's basically a project management nightmare. I mean, you don't just wake up one day with the capacity to categorize 4 decades of memories and execute a real estate transaction all at the exact same time.
No, of course not. And the data shows the stakes of staying in that gridlock are severe. When older adults delay these transitions without proper support, that chronic stress has real, measurable health consequences.
Wow. Like what kind of consequences?
We are talking about elevated cortisol levels, severe caregiver burnout for adult children who are trying to help, and an exponentially higher physical risk of falls.
That's terrifying, honestly.
It is. Delaying the transition doesn't pause the aging process, It just amplifies the hazards in your environment.
Right. Which means we need to build that missing roadmap for you right now. But before we can explore the logistics of how to move, our sources make it really clear we need to define where you might actually be going.
Yes, the terminology is a huge barrier.
It's a completely different language. The senior housing industry has its own complex vocabulary. And if we don't translate that jargon first, the rest of the process is just going to sound like noise.
Absolutely.
So let's map out the destination options using a physical framework. Think of the housing spectrum like different tiers of a cruise line vacation.
Oh, I like that. It's a helpful analogy, especially if we look at it from an engineering perspective, like how the environment is designed to actually support the passenger.
Right. So at the first tier, you have what the industry calls independent living. Think of this as booking a luxury suite on the main cruise ship.
Okay, sounds nice.
It is. You have your own private cabin, you lock your door whenever you want, and you operate on your own schedule. But the infrastructure of this ship is designed to remove all the daily friction.
So no chores, basically.
Exactly. There is no lawn to mow, there's no roof to repair, and dining options are literally just an elevator right away.
Yeah.
You maintain absolute autonomy, but that burdensome maintenance of life is completely stripped away.
But there is one major caveat there that separates it from just, renting a regular apartment. The staff and the physical environment are engineered for accessibility. So it is autonomy, but it's engineered for safety and social engagement.
Okay, that makes sense. Then, moving along the spectrum, you have assisted living. This is like being on that exact same cruise ship, but your booking includes a dedicated support team.
Right, like a concierge service.
Exactly. You have a personal concierge who comes to your room to assist with the structural activities of daily life. They ensure you get dressed safely, they handle bathing without fall risks, and this is crucial, they manage the complex timing of your medications.
So the social environment feels identical, but the physical support is much more active.
Yeah, exactly.
Which brings us to the highest level of facility care, which is skilled nursing, or you'll often hear it referred to as long-term care. Sticking with your cruise framework, this isn't the luxury liner anymore. This is a fully staffed hospital ship.
Oh, okay. So a major shift in the level of care.
A massive shift. It is an environment built strictly around round-the-clock clinical and medical support for complex health conditions that just cannot be managed with a simple daily visit from a nurse.
Right. Now, obviously, moving to a facility isn't the only path you can take. The sources outline several other models. There is aging in place, which essentially means, retrofitting your current ship.
Yes, modifying what you already have.
You stay in your home, but you systematically upgrade the environment. You install commercial-grade grab bars, maybe convert your tubs to zero-threshold walk-in showers. You'd also drastically alter the lighting to eliminate those shadows that can cause falls and bring in external home care staff.
And we shouldn't overlook a really simple real estate transition, which is just downsizing.
Oh, right, just moving to a more manageable space.
Exactly. Moving from a multi-level, high-maintenance family home to a single-story, accessible condo. And finally, there is specialized memory care.
How does that differ from the others?
It's a unique environment designed specifically for the cognitive safety of individuals dealing with dementia or Alzheimer's. The architecture itself is actually used as a care tool.
Wait, the architecture? How so?
Yeah, it features secure boundaries to prevent wandering and specialized visual cues like certain colors or lighting to reduce confusion and anxiety.
That is fascinating.
Yeah.
But I want to stop right there because as I was digging through the research for this, I hit a massive financial assumption that we need to clear up immediately.
I think I know where you're going with this.
Yeah. We have this destination vocabulary now, but there is this pervasive, almost default belief regarding how all of this gets funded. A vast majority of families assume their safety net, specifically Medicare, will just step in and cover the cost of these facilities when the time comes.
Oh, boy. Yes. That is perhaps the most dangerous myth in the entire landscape of aging. We really have to clarify the mechanical reality of the system here.
Please do, because it shocked me.
Medicare does not cover the cost of assisted living or long-term custodial care, period.
Not at all.
Not at all. Medicare is strictly a medical insurance program. It is designed to pay for doctors, hospitals, and specific medical procedures. Assisted living falls under what they call custodial care, which is help with daily living activities. And Medicare explicitly excludes that.
Wait, so if you just assume Medicare is going to pay the, $5,000 or $8,000 a month for that assisted living cruise ship, you are going to be staring down a terrifying financial cliff when that first bill arrives.
Exactly. It completely alters your strategic landscape. Now, Medicare might cover a brief, short-term stay in a skilled nursing facility for rehabilitation after a qualifying hospital admission.
Like if you fall and break a hip.
Right. If you're recovering from a broken hip, they'll cover the rehab. But the moment you are stabilized, the funding stops. You cannot rely on a medical safety net to solve a housing and custodial care problem.
Wow. Which fundamentally changes the timeline of when you need to act. If Medicare isn't swooping in to save the day, and the physical logistics of dealing with the house are paralyzing, how do you bridge that gap without just collapsing under the stress?
It's a lot to manage on your own.
It is. And you don't just, hire a guy with a moving truck and hope for the best. The sources point to an entire hidden industry of specialists. If we look at this transition as a major infrastructure project, we really need to introduce the specialized crew.
And treating it like an infrastructure project is the exact right approach to take. The first specialist you need to know about is the geriatric care manager.
Okay, what do they do?
These are typically licensed nurses or clinical social workers. In your project analogy, they are the systems engineers. They don't look at just the physical house. They look at the intersecting stress points of a senior's entire life.
So they're looking at the big picture.
Exactly. They evaluate mobility, cognitive decline, medication management, and social isolation. They do all this to determine exactly where the load-bearing walls of daily life are failing.
I see. So they basically write the blueprint for what kind of care is actually required.
Precisely.
Then you hand that blueprint to a senior placement specialist. If the care manager is the engineer, the placement specialist is your specialized real estate agent.
That's a perfect way to put it.
They take your specific medical and financial requirements and find the facility that matches. But I have a highly skeptical question here based on the text.
Go for it.
The sources mention that placement specialists are often completely free to the families. How does that work? If someone is doing weeks of market research for me, how are they putting food on their own table?
It is entirely fair to question the financial motives there. Senior placement specialists operate on a commission model, much like a travel agent or a real estate broker.
Okay.
If they successfully match you with a community and you move in, that specific facility pays them a finder's fee out of their own marketing budget, so the family does not write them a check directly.
Okay, but doesn't that inherently create a conflict of interest? Like, do they just push you toward the most expensive luxury liner because it pays the highest commission?
Well, a predatory one might, which is why vetting them is so crucial. But a reputable placement specialist provides an analytical service you just cannot easily replicate yourself.
Because they know the market so well.
Exactly. Because they operate in this specific market every single day, they see straight through a facility's glossy marketing brochures. They know what the actual staff-to-resident ratios are behind closed doors.
Oh, that's incredibly valuable.
It is. They know if a community just lost its director of nursing, or which facility genuinely has the capacity to handle, say, advancing Parkinson's versus one that just claims they do to get you in the door. They save families weeks of exhausting trial and error research by filtering out the places that look good on paper but fail in practice.
That makes total sense.
Yeah.
They are providing insider market intelligence that you just can't get from a Google search.
Right.
Now, what about the physical execution of the move? Let's talk about the general contractors of this operation, the senior move managers.
These professionals are fantastic. They are certified by an organization called NASMM, that's the National Association of Senior Move Managers, and their role goes far beyond just loading boxes onto a moving truck.
What else are they doing?
They specialize in the spatial and emotional logistics of downsizing.
Yeah.
They will literally sit down with a floor plan of your new apartment and measure your current furniture to show you exactly what will fit and what won't.
That takes so much guesswork out of it.
It does. They manage the estate sales, coordinate the donations of unwanted items, and they supervise the actual moving day so you don't have to.
The sources even note that they unpack and recreate your living space at the new place.
Yeah.
So you walk into the new apartment, and your coffee maker and your favorite chair are set up exactly how your muscle memory expects them to be.
Yes.
I mean, that alone removes a massive amount of transition trauma.
It preserves a really vital sense of environmental continuity. And, there is one more resource to add to this crew, a government-funded entity called the Area Agencies on Aging, or AAAs.
AAAs. Got it. What do they handle?
These are localized hubs designed to connect older adults with community resources, transition counseling, and even legal assistance. You can actually locate your local agency through the federal portal at acl.gov. They act as an objective, non-commercial starting point for gathering intelligence.
So we have defined the vocabulary, and we have identified the specialized crew. But reading about an engineer, a placement agent, and a move manager is very different from getting them all to actually communicate with each other.
Oh, absolutely.
When these professionals are siloed, the family is still stuck playing the role of project manager, right? Trying to synchronize all the moving pieces. How does this actually work in practice?
That synchronization is absolutely the hardest part. But our sources highlight an organization that solves this exact friction point by bringing all these services under a single umbrella.
Oh, really? What are they called?
The organization is called Next Chapter Home Transitions, and they operate primarily on Long Island across Suffolk County. The methodology they use is called life transition planning.
Life transition planning. I like that. It reframes the whole event from a chaotic chore to like a strategic deployment.
Exactly. What makes a synchronized model like Next Chapter so effective is that they coordinate 5 distinct pillars simultaneously.
Okay, let's break those down.
Pillar 1 is the real estate strategy for the current family home, determining if it should be sold as is, maybe repaired first, or even rented out. Pillar 2 is senior care navigation, utilizing that placement specialist data we talked about to find the next environment.
Right, finding the right ship.
Exactly. Pillar 3 is financial awareness, analyzing the actual assets available, especially now that we know Medicare isn't covering the bill. Pillar 4 is the physical home preparation and the moving logistics.
And then there's Pillar 5, which is family coordination. I really want to pause and dig into the mechanics of this one because earlier we mentioned the gridlock caused by tense family dynamics.
It's a huge obstacle.
How does a service like this actually mediate those conflicts?
It works by replacing emotional arguments with objective data. When adult siblings try to manage this alone, the conversations are usually fueled by guilt, differing opinions on mom's capabilities, and, let's be honest, historical family baggage.
Right. Everyone falls back into their childhood role.
Exactly. But when a professional transition planner steps into the room, they act as an objective third party. They bring in the geriatric care manager's assessment. They can say, I understand you want your father to stay in the house, but the clinical assessment shows a severe fall risk, and here is the data.
Oh, I see. So it takes the personal sting out of it.
It diffuses the tension completely because the family isn't arguing with each other anymore. They are collaborating around a professional diagnosis. It allows the family members to just be a family rather than acting as opposing project managers.
That psychological relief has to be immense. Furthermore, the sources emphasize how heavily a service like Next Chapter coordinates with elder law attorneys and financial planners. And this brings up a massive mechanical trap that families fall into, the Medicaid look-back period.
Yes, this is a critical point.
Because if Medicare doesn't pay for long-term care, people eventually turn to Medicaid once their personal funds deplete. But you can't just give your money away to your kids to qualify for Medicaid, right?
Precisely. Medicaid has a very strict 5-year look-back period. If you sell the family home and suddenly transfer a large sum of money to an adult child, Medicaid will penalize you and significantly delay your eligibility for care.
So you could be left with no money and no coverage.
Exactly. Families who try to navigate a real estate sale and a facility move without an elder law attorney often trigger these penalties entirely by accident. A synchronized service ensures the legal asset protection is locked in before the house ever even hits the market.
We preach this constantly on the Senior Techie. You have to install the right systems before the system crashes. Proactive infrastructure beats reactive scrambling every single time.
Every time.
So how do we operationalize this? We've mapped a vocabulary, we know the specialists exist, and we understand the value of synchronization. Let's build an exact blueprint for you, the listener. What are the specific, actionable steps you can take today?
There are 4 concrete sequential steps you can take to regain control of this process right now. Step 1, contact your local area agency on aging. You just go to eldercare.aatel.gov and request a comprehensive needs assessment.
That's free, right?
Yes, it is a free service that provides an objective baseline of your current situation.
Excellent. Step 2, if the sheer volume of physical belongings is your primary source of paralysis, go to nasmm.org. That is nasmm.org. Search for a certified senior move manager in your zip code.
And you don't have to hire them to move tomorrow. Just schedule a consultation to understand the mechanics of how they break down a 40-year household.
Exactly. Get the information. Step 3, reach out to a local senior placement specialist.
Let them do the heavy lifting of the market research. Have them explain the true financial costs and the actual staffing realities of the care communities in your specific area, so you aren't just relying on assumptions.
And step 4, secure an elder law attorney immediately. Do this before you list a property, before you sign a facility contract, and certainly before you move any assets around. Map out your legal liabilities first.
Implementing those 4 steps puts you entirely in the driver's seat. But the critical variable here is timing.
When should people actually start this process?
The optimal moment to execute these steps is the exact moment you begin noticing the signals of systemic strain.
What do those signals look like?
Well, if the mail is piling up unread, or if the refrigerator is full of expired food because grocery shopping has become too physically taxing, or if social isolation has set in because navigating the front steps is just frightening now, those are the structural signals.
Waiting for a crisis to force your hand, like waiting for a fractured hip or a sudden hospitalization, that means you forfeit your autonomy. You end up making permanent, complex financial and housing decisions under extreme duress.
Often from a hospital bed.
Which is the worst possible time to make a major life decision.
Absolutely. Now, as you begin reaching out to these specialists, we must establish a vital guardrail here. Because this industry deals with individuals during highly vulnerable transitions, bad actors naturally follow.
Sadly, yes.
The sources issue a stark warning about predatory moving consultants. These are unregulated scammers designed to exploit the urgency and confusion of downsizing.
It is an unfortunate reality of any complex system. There are always those looking to exploit the vulnerabilities. We want to ensure your transition is fully protected.
Exactly.
The federal government actively tracks these predatory schemes. Before you hand over a deposit or sign a binding contract or allow anyone access to your financial data, you need to verify their legitimacy. The FBI and the FTC maintain a specific resource portal for this.
Where can they find that?
Go directly to reportfraud.ftc.gov. Doing your due diligence isn't just an extra chore. It is a fundamental part of maintaining control over your transition.
It is the ultimate form of self-advocacy. And, as we synthesize all of this research today, I really want to leave you with a shift in perspective.
Okay, let's hear it.
We have spent this time analyzing the heavy logistics, the legal hurdles, and the undeniable stress of transitioning. But look at the inverse. Consider the profound liberation that comes from shedding an environment that no longer serves you.
That's a beautiful way to look at it.
Imagine waking up tomorrow and knowing the leaking roof is not your problem. Imagine knowing the steep staircase is no longer a daily threat and that social connection is right outside your door.
Sounds like a massive relief.
It is. When you proactively design your next chapter using these specialized tools, you aren't surrendering your independence. You are actively engineering an environment that allows you to live with significantly more freedom.
This podcast was brought to you by The Senior Techie. It's available on Apple Podcasts, YouTube, and Spotify. If you'd like to receive their free newsletters, you can subscribe at subscribe.theseniortechie.com.